Hello, welcome to the lesson on dual diagnosis and relapse prevention. Um, these two topics come directly from the Clean book and are extremely relevant topics, especially during the assessment and treatment phase with clients that we just can't lose sight of because both topics impact um, almost all, if not the majority, of substance using clients. The first being dual diagnosis, and the majority of patients, substance abusing patients who have addictions or significantly abuse substances, have a supplemental mental health diagnosis. And many times that supplemental health diagnosis drives and encourages the use of the illegal substance or misuse of the prescription drug and so forth. So we must be willing to help clients address not only the drug using part of their being, but also the other life issues that are occurring um, and encouraging their use. Simply helping someone find sobriety from alcohol, but not helping them with their anxiety or depression really sabotages the whole idea of helping clients improve their life status, their quality of life, and the ability to sustain long-term sobriety. Um, so the clean chapter is a good chapter on dual diagnosis material. The second part of the lesson is on relapse prevention and the fact that the majority of clients who face addiction relapse and use again after short-term or long-term periods of use. And relapse happens for a variety of reasons, in a variety of timetables, in a variety of methods, based on the individual needs and characteristics of that person. But we must teach clients in advance of that relapse how to monitor symptoms of relapse and triggers of relapse, what to do when they do relapse, and how to build off the experience. Because relapse brings with it significant shame and despair, usually depression, feelings of failure, that all of the hard work the client has done in the past days to stay clean has been lost. And that's not true at all. The client that for example has been clean for 2 weeks, who believes just because they relapsed on the 15th day that they lost all of that clean time, really did not. They were still clean for 14 days, and we can take lessons from those 14 days and from last night, for example, that moment of relapse, and learn how to respond better to that particular circumstance or situation on down the road. And how we can start talking about relapse is the first day that you meet the client. Before they're ever clean is when you start talking about relapse and preparing clients for relapse. Talking about relapse does not give the patient or client permission to use again. It's quite the opposite. It gives them permission to stay clean and to know what to expect. Because many times I have been part of the treatment experience where relapse has never been mentioned, ever. And the client is shocked when they relapse, or the family is shocked when a relapse occurs, and all progress that was made is lost simply because we didn't prepare family members and the individual in terms of what to respond to and how to respond during what society perceives as failure, but really is not. I've included significant videos and reading material from Terence Gorski. Gorski is one of the leaders, if not the leader, of relapse prevention research and treatment with clients, especially criminal justice and dually diagnosed clients in the United States. His work is really beyond reproach and is well respected, not only nationally but internationally. I look forward to hearing from everybody's discussion board post, and take care.